Just continuing on with task number 19, I have my friend Sophie here. She's a 13-year-old female spayed canine pit bull mix. So I'm going to get a little bit of blood work from her jugular vein as well, because she might be my potential donor for the cross match. So I have my 3cc syringe with a 22 gauge needle already attached. I have a lavender EDTA tube labeled with the patient's name, date, and species. I have a pen, and I have my alcohol. So my assistant is just going to restrain her, and I'm just going to put my finger in the jugular groove just to feel for the jugular vein. I'm going to just squirt a little bit of alcohol. Okay, and then we're just going to grab my syringe. We're going to take off the cap. I'm going to pull back to make sure that my plunger doesn't get stuck at all, and then we're going to go bevel up into the jugular vein. Good girl. Such a good girl. And I'm going to get 3 mLs. Alright, so then I'm just going to have my assistant hold off right where the bevel went into the vein. I'm just going to do the one-hand approach. Let's get my cap back on. I'm going to take off my needle. Take off the cap, and then we're gently just going to put my sample into the lavender top tube just because I don't want to damage any cells by having it go through the needle. And then I'm going to put the cap back on tightly, and we're going to invert it 4 to 6 times just to make sure that we're nice and mixed with the EDTA. Alright, so we're nice and mixed. And again, I have the patient's name, date, and species, and I'm just going to make a note with my pen that she is my possible donor. Okay, so I'm just going to go ahead and just make sure that she doesn't have any hematoma or any bleeding on her neck, which she's good. So I'm going to go ahead and get my friend back in her cage, and then in a moment we're going to get started with doing our cross match.